This is Duke University.
It's a pleasure to be here at Duke. It's encouraging that so many people are interested in HIV/AIDS in Africa and children affected by AIDS. Some of the things we're going to talk about here started in very lonely situations because there weren't many people working in AIDS 18 or 20 years ago. And it's encouraging there is so much interest to get really what I would like to see is the best and the brightest working in the most difficult situations. And your abilities and talents will be magnified thousands of times with the kind of impact we're going to talk about. The reason I decided to talk about orphans and children affected by AIDS is simply because it's the biggest need we face in Africa right now. Children under 15 infected with HIV. 270,000 children died from HIV. This is just last year. 370,000 children newly infected with HIV. So a very rising epidemic, especially in children and young children. In the United States, we've seen the AIDS epidemic plateau off and go down in some groups. You don't hear about as much in the news. In Africa, in southern Africa, right now, the epidemic is still raging out of control. Developments. These are some related to children I want to talk about in a minute. Death rates have decreased some due to a number of interventions we've had. That's encouraging. New infections have decreased some due to Pmtct. Pmtct coverage has increased. Now, this is prevention of mother-to-child transmission. And the effect of this is that we've increased. These are pregnant women who can access Pmtct services. Was only 14% across Africa in large surveys. Now it's gone up. Now, remember, we ought to be addressing 100% of the pregnant women. So we were doing dismally poor. Now we're doing better, and that's decreased the new infection rate some, but still we have a long way to go. A lot of children still have surviving parents that we need to support, caregivers. There's a big initiative called JLICA, the Joint Learning Initiative on Children and AIDS, that's providing a lot of evidence-based research. So I'm glad there are researchers in the room because there's a huge need to do evidence-based research across some of these issues. Over the last 10 or 20 years, large numbers of adults living with AIDS, and that increasing, plateauing off now and going down in a few countries, but still raging in southern Africa. Large numbers of people dying due to HIV, again, plateauing in some countries. But what we're seeing now is huge numbers of orphans. If the AIDS epidemic stopped today, we'd still be dealing with the socioeconomic impact for the next 30 years regarding HIV because we're talking about, right now, 13 to 14 million orphans. Certainly by the year 2010, over 20 million orphans due to AIDS. So what I want to let you know is, whether you hear about it or not, for the next number of years, the orphan epidemic is soaring. To try to keep kids in school, at the same time to provide some economic strengthening, to provide some nutritional support for child-headed households, for granny-led households, which are evolving in great numbers as we speak. So what we do is try to provide a comprehensive, integrated community approach looking at what we call a child status index. That means we look at a lot of different factors to see how well little Johnny or little Mary's doing, and we try to provide a comprehensive approach because all of these are very important factors, each independently, especially all working together. We're seeing large numbers of children now. We need to address prevention among orphans, a huge issue, because now the orphans are getting to be 13, 14, 15 years old. Let me tell you what's going on in terms of treatment. Now, one of the most important things is to treat children early. There's a blood test called a PCR you can do within the first few months to put kids on treatment early, okay? Without treatment, within the first year, about 30% of the kids die. Within the second year, 40%. The third year, 50%. But in a very large survey in Africa, treatment within the first few months, only 8% of the children could access that. And so treatment is a huge issue among children, even as we speak. Clotrimoxazole, which is a preventative therapy that's very readily accessible, that's cost-effective and cheap, only 4% of the kids were getting it early. Of the children that need treatment with antiretrovirals, less than 10% are getting it now as we speak. Only 10%. And so the biggest need of the hour in Africa right now is orphans. The biggest need they face, one of the biggest needs is treatment. Okay? And some of the reasons for that are that treatment's expensive for children. There's pediatric formulations that are complicated. Health workers need to be trained on how to give those treatments. There's a number of factors that we're trying to improve, but this is a huge problem right now as we speak. The challenge we've described, and it's overwhelming in many, many ways. I'd love for all of you to come out to Africa and help us, every single one of you. On the other hand, you need to know that you can have impact. This is a partnership that we put together called the Anchor Partnership, African Network for Children Orphaned and at Risk. So this is another key to the HIV/AIDS epidemic, especially with children, and that's partnership. Presently, at the end of 2007, we're helping 53,000 orphans and children affected by AIDS on a regular basis. In 2010, we're going to hit 145,000 children through this existing partnership. With new partners, we hope to go up to about 160,000 children. Our opportunities for partnership, and Dr. Mercer and I have already talked about this today, we certainly need to continue doing basic research across HIV, particularly behavioral research around change in behavior, certainly for orphans and youth. We'd like to get operational research done and be more efficient, effective in what we do. But certainly we'd like to develop partnerships for internships and fellowships. We have volunteer activities. And together I think we can develop great partnerships to look at new sites and new programs, working together with great partners like Duke. We want to thank the U.S. government, PEPFAR, USAID, a number of other big foundations, Emory School of Public Health, Rotary, and a number of other big corporate donors for all their help. Thank you very much.